This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. What are some of your, in Mother Baby, what are some of your favorite patients to take care of and some of the most challenging, you think?
My favorite. I actually love antepartum patients, which are patients who have their stay in the hospital prior to having their baby.
Yeah.
They're pretty self-sufficient, but that's not the only reason. The main reason is because I like developing those relationships with my patients. And on mother infant, sometimes it's hard in comparison to maybe med surg or so, because, med surg, you may have someone there for a long time.
Yeah.
Mother infant, typically, they may be there for 24 hours or they may be there for 4 days.
Mm-hmm.
And so you may get a patient who you really create a good, trusting relationship with, and then they'll be gone the next day.
Yeah.
So I like those kind of patients, the antepartum patients. And then I also, the standard vaginal delivery, of course, is always a little easier. Or experienced moms are easier sometimes.
Yeah.
And then I would say the most challenging would be C-sections or people who have experienced birth trauma, a NICU mom, because it's like you just went through all of this hardship. Your birth didn't go as planned, and then your baby isn't up here as well. Or teenage moms, or those with lack of support.
Sure.
Are a little more challenging to care for.
Yeah, I can imagine.
Yeah, so those are kind of the harder ones, but it's like a fine line, because you may have a C-section, for example. You may have a C-section mom. This is her first baby. She is 18 years old and she does very well. She may be like feeding the baby, changing the baby, on top of everything. So I kind of always go into things with a clear mindset. Like, I'm not like, oh, this gonna be great.
Yeah. Maybe like not go in with like a preconceived notion that like they don't have it,
Right. And everybody has different pain management.
Yeah.
I've had people, C-section moms have Foleys. We like to take the Foley out within 12 hours because, evidence shows Foleys can increase the risk of infection. So we want to keep it in there as least as possible. So I've had a mom come up from labor delivery. She just had her baby 3 or 4 hours ago, and she's like, when can I take a shower? And I'm like, hold on now. We're going to get you situated first. And then you may have someone who is very different and is having some pain management issues, and they've hit their 12-hour mark for their Foley to be pulled, and they don't want to get up.
Yeah.
So it's different. It's different for different people.